Minister of Finance and Economic Development Mthuli Ncube, on behalf of the Zimbabwean government, who received $46 million United States dollars from the European Union to fund next year's polls and the health sector, according to an agreement signed at a ceremony held in the capital today.
Today marks another historic milestone in the relationship between the government of Zimbabwe and the European Union through the signing of two financing agreements on improving health outcomes for the population of Zimbabwe. This is 41 million euros, which is about $40 million US dollars. And the second one is the support for the Zimbabwe electoral process. That's a 6 million euro grant, which is approximately 5.9 million US dollars. The support comes at an opportune time when government is prioritizing the strengthening of good governance in order to foster economic development. Globally, it has been acknowledged that building institutional capacities is critical for economic growth and development. In this regard, I'd like to applaud the European Union for extending capacity building support to the Zimbabwe Electoral Commission, ZEC, as well as contributing to democratic processes in Zimbabwe. I'm confident that this support will build upon the previous interventions and strengthen ZEC to carry out its mandate efficiently. Allow me, distinguished guests, ladies and gentlemen, to express our sincere gratitude to the European Union on behalf of the government of Zimbabwe for the continued support received from the EU.
The Zimbabwean government has in the past accused the EU of funding regime change agents in the country with the aim of ousting the ruling ZANU-PF from power. Relations between the EU and Zimbabwe appear to be very frosty in public, even as the government received huge budgets from the West. EU Ambassador Jobs von Kirchmann said the EU wants Zimbabwe to succeed and therefore will fund the Zimbabwe Electoral Commission to the tune of 5.9 million United States dollars.
And looking to next year, I think we all agree that credible and peaceful elections will be a key element that will allow Zimbabwe to create a prosperous environment and to make the National Development Strategy 1 and Vision 2030 a reality. To contribute to that, and in line with the NDS 1 strategy of strengthening the capacity of independent commissions, the European Union is committing today 4.5 million euros to the Zimbabwe Electoral Commission to deliver on its mandate. And actually, when I presented my credentials to His Excellency President Mnangagwa back in October, and I asked him, how could the EU support elections next year? He suggested a support to a Zimbabwe Electoral Commission, which I think is a good thing because also we have done it in the past, and I think it's also a continuation of our engagement. So I'm very happy we can make this happen today, and obviously we have also other donors joining, in particular France, who is also a member of what we call the Team Europe, and I think the funds will be then administered by the UNDP in a basket fund. Finally, the support to SEC will also be complemented by additional support to civil society on electoral litigation, advocacy, voter education and monitoring.
ZEC chairperson was at hand to receive the donation from the EU, saying the bloc has helped build democracy in Zimbabwe.
I would like to take this opportunity here today to appreciate the unwavering support from the European Union towards democratization of the electoral processes through the Zimbabwe Electoral Commission Capacity Building Project, otherwise known as ZimEco. Thank you very much, Your Excellency. We had the first phase of the ZimEco from 2016 to 2020. And I think through that project, we have managed, between the EU, other funding partners, and ZEC, to actually recognize that in terms of international best practices, elections are now a process and not an event. In the past, I think governments would budget for elections towards every 5-year period. But now we find that although we're primarily funded by the government of Zimbabwe, for which I'm extremely grateful to you, Professor, and your ministry, we do also appreciate the ZimEco project. Through the ZimEco project, we were able to enhance certain outputs, such as strengthened institutional and electoral capacity of ZEC to meet its constitutional mandate to ensure sustainability, sustainable voter registration system for the 2018 elections and beyond, enhanced and effective ZEC's engagement with electoral stakeholders, including eligible voters. I would like to say, Your Excellency, that the ZimEco project is very instrumental in assisting us with our multi-party liaison committees, which, as you already know, instead of holding them towards the elections, towards the end of every 5-year period, we now hold them periodically, in fact 4 times a year, and also through ZimEco together with the government of Zimbabwe, as I've said. So we appreciate that very much. The ZimEco project is also instrumental in supporting various and important polling processes. I know that support from the outgoing project went towards even the delimitation exercise, which we are at the tail end of. And I know that in terms of the incoming finance, you'll be able to assist us with the harmonized elections next year. So to achieve these outputs, the European Union committed and availed 8.6 million to augment the government of Zimbabwe's support towards electoral processes in the first phase. And this was imperative, and it did fill in financial gaps, especially with regards to foreign currency requirements. And we appreciate that. So in terms of the new financing agreement for 4.6 million, which His Excellency has clarified will be for a 3-year period, we appreciate that the EU will continue to propel and complement the government of Zimbabwe to support electoral processes through the ZimEco Project 2, and that the signature between yourself, Your Excellency, and the Minister of Finance today will actually signal the start of hopefully the disbursement of those funds. So it is my hope that this kind of relationship will continue, such that election processes embrace effectiveness, accountability, inclusion, peace, justice, and transparency. I would like to say we are very indebted to you, Your Excellency. Thank you.
Turning to health, Von Kretschmann said the EU will also fund the health sector, which has been struggling owing to poor funding, poor salaries for nurses and doctors over the past years. Zimbabwe has lost over 4,000 nurses and doctors to other countries.
So you already mentioned the 2 financing agreements. The first one is effectively on health. Now, I will cite something, and you have to guess where it comes from. Improved health is central to human happiness, well-being, and economic process. As healthy populations live longer, are more productive, and accumulate more savings. That is coming from the National Development Plan. I think it's very well said. And also health is enshrined in the Zimbabwe's constitution, and therefore the European Union is very happy that we can accompany you in this endeavor, in the vision for 2020. And with our 41 million euros, which we commit today, and I have actually good news, it's not for 7 years, it's for the next 3 years actually only. And then we look at what we can make available afterwards. We will joining forces with the government and with other donors, namely the UK and Ireland, and also not to forget all the implementing agencies, UNICEF, WHO, UNFPA. But we will be the biggest donor in this health fund. And therefore I'm really proud that we can help to set it up, the Health Resilient Fund, which I think we will launch in due course over the next weeks even. Now this fund builds on the experience and the successes of the health fund, which was already there. And I will not enter into detail, but the existing health fund also, I think, has proven really a success, because you could in particular reduce enormously maternal mortality, also child mortality. I think it was already a very good instrument, and I'm sure the next one will be even go beyond what we can expect. Now, Honorable Dr. Mangwiro, Deputy Minister for Health and Childcare, allow me to extend my thanks to you, but also your team, and for all the efforts you did in assisting the program and in moving forward. And we express our readiness as EU to support you in that endeavor.
The Finance Minister thanked the EU for helping fund the government's COVID-19 response.
The improving health outcomes for the population of Zimbabwe agenda, the support will be channeled through the newly established Health Resilience Fund, HRIF, which is a successor to the Health Development Fund, HDF. The project will be implemented by the government, the Ministry of Health and Child Care, and UNICEF, and has the objective of saving lives with a strategic focus on leaving no one behind, targeting the most vulnerable in society, as well as strengthening health delivery systems and the sector's preparedness against emerging diseases. Even beyond COVID-19, who knows what else will come along. The continued support to our health sector by the EU and the development partners is commendable and has been key in strengthening our health service delivery and our response to the COVID-19 pandemic. The country remains focused at achieving the high standard of healthcare delivery and to attain high quality of life for all its citizens. We are cognizant of the fact that on our own we might take longer to achieve this aspiration, hence the need to forge strong partnerships with all key stakeholders, including development partners like the European Union. On the other hand, the support to the Zimbabwean electoral process will be implemented by the government and UNDP and aims to contribute to the consolidation of democracy and peace, with particular emphasis on inclusion, particularly representation from women, youth, and persons with disabilities in the democratic processes. Most of you would recall that in 2015, the government and the EU signed the National Indicative Programme amounting to 234 million euros under the 11th European Development Fund. This support was later increased to 287 million euros, focusing on agriculture-based economic development, health, and governance and institution building. The following programs and projects have been implemented under the 11th EDF, among others: the contribution to the Health Development Fund, the Zimbabwe Agricultural Growth Program, the Resilience Building and Food and Nutrition Security Program, the Justice for All Program, the Capacity Building to Zimbabwe Electoral Commission Project, the support to civil society, the support to National Authorizing Office and NAO, Technical Cooperation Facility, and finally the Zimbabwe Natural Resources Management Program.
Deputy Minister of Health John Mangwiro weighed in, giving thanks to the West, who appear to be Zimbabwe's sworn enemies.
Any nation, like you rightly quoted, is only good as its health. A healthy nation gives a healthy outcome. His Excellency, the President, Dr. E.D. Mnangagwa, gave us a beacon to say by 2030 we must be an upper middle income economy. That cannot be achieved without good health. And good health starts with primary health care. As government, we are moving towards that, to the extent that we are already constructing more than 3,000 village health centers. This means, as a country, we are organized into provinces. Each province has a hospital, and each province is divided into districts, and each district has a hospital which is supported by clinics around each district hospital. And each rural health center is in turn supported by a village health center manned by village health workers, whom we have been being supported by NGOs, but the government is going to be putting them on full salaries. So our system is such that we are able to get to everybody's doorstep. This is the essence of primary health care, where we are able to look and care for everyone's primary health needs, which definitely, if anyone in life does not follow the primary aims or dictates of any subject, it will be difficult. So health's most important part is primary health care. So we stick to it and do it properly. Besides the primary health care, it's also going to support emergencies. We saw the emerging of the COVID-19. We do not know what will come in the future. We know these viruses, bacteria, and all other organisms, and nature might become an emergency like we saw with Cyclone Idai. We will need to respond positively, and we are very grateful that you are supporting this line of medical management, because definitely it gives us strength and courage to continue looking after our healthy population. By 2030, our health standards must also equal that level as we go along following the NDS1. And definitely, I'm happy to hear that the period is much shorter and some more is coming. Then this definitely means, as a country, our primary health care programs will be much stronger and longer. I want to thank you.
Despite talking brave, Zimbabwe continues to receive support from the EU and other Western countries which fund critical areas of social services. Atricia Gondo, HSTV News and Current Affairs.